Coffee is one of the most widely consumed beverages globally, cherished for its stimulating properties and rich flavor. However, its effects on health have been the subject of numerous studies, with particular interest in its impact on bone health. This video explores the relationship between coffee consumption and bone health, examining the mechanisms involved, the conflicting findings in research, and recommendations for coffee drinkers. But first, please like, share, and subscribe so you don't miss any of our informative content. Let's go! Bone health is crucial for overall well-being, particularly as we age. Bones provide structural support, protect vital organs, and house essential minerals like calcium. Osteoporosis, a condition characterized by weakened bones and an increased risk of fractures, is a significant health concern, especially among older adults. Factors influencing bone health include genetics, nutrition, physical activity, hormonal balance, and lifestyle choices, including the consumption of beverages like coffee. The composition of coffee is a complex beverage containing various bioactive compounds, including caffeine, antioxidants, and polyphenols. The two most popular types of coffee, Arabica and Robusta, contain different levels of these compounds, but both generally provide significant amounts of caffeine, which is the primary focus when discussing coffee's effects on health. Caffeine and bone health. Caffeine, the most prominent psychoactive substance in coffee, has been shown to have both positive and negative effects on bone health. The relationship between caffeine and bone density has been extensively studied, revealing mixed results. Calcium absorption. Caffeine may inhibit calcium absorption in the intestines. Some studies suggest that high caffeine intake can lead to increased calcium excretion in urine, which could potentially weaken bones if not balanced by adequate calcium intake. Bone density. Research on caffeine's impact on bone mineral density, BMD, has yielded inconsistent results. Some studies indicate that high caffeine consumption is associated with lower BMD, particularly in populations with low calcium intake. Conversely, other studies find no significant link between moderate coffee consumption and reduced BMD. Fracture risk. The association between coffee consumption and fracture risk has also been debated. While some studies suggest an increased risk of fractures with high coffee intake, others report no significant correlation, particularly in individuals who maintain sufficient calcium intake. Antioxidants and polyphenols. In addition to caffeine, coffee is rich in antioxidants and polyphenols, which may positively affect bone health. These compounds have been associated with anti-inflammatory effects and may play a role in bone metabolism. Anti-inflammatory properties. Chronic inflammation can contribute to bone loss. The antioxidants found in coffee may help reduce inflammatory markers in the body, potentially benefiting bone health. Bone formation. Some studies suggest that polyphenols might stimulate osteoblast activity, cells responsible for bone formation, and inhibit osteoclast activity, cells involved in bone resorption. This balance is critical for maintaining bone density. The role of other nutrients. The impact of coffee on bone health cannot be considered in isolation. The overall diet, including the intake of calcium, vitamin D, and other nutrients, plays a crucial role in determining bone health outcomes. Calcium intake. For individuals who consume coffee regularly, ensuring adequate calcium intake is vital. Studies have shown that individuals with high caffeine consumption who also have low calcium intake may be at a greater risk for decreased bone density. Vitamin D. Vitamin D is essential for calcium absorption. Insufficient vitamin D levels can exacerbate the negative effects of caffeine on bone health. A balanced diet rich in both calcium and vitamin D can mitigate potential adverse effects. Population-specific considerations. Age and gender. The effects of coffee on bone health can vary significantly across different demographics, particularly age and gender. Older adults, especially postmenopausal women, are at a higher risk for osteoporosis. Studies suggest that high coffee consumption in this demographic might correlate with lower bone density, particularly in those who do not consume enough calcium. Men versus women. Research indicates that women may be more susceptible to the negative effects of caffeine on bone health than men. Hormonal differences and variations in body composition may contribute to this disparity. Conflicting research findings. The research on coffee and bone health presents a complex picture. Some studies report negative associations between high coffee intake and bone density, while others find no significant effects or even potential benefits. Variations in study design, sample size, and population characteristics can lead to conflicting results. Additionally, many studies rely on self-reported coffee consumption, which can introduce bias. The consensus among researchers is that moderate coffee consumption, typically defined as 3–4 cups per day, is unlikely to have a detrimental effect on bone health in most individuals, particularly when accompanied by adequate calcium and vitamin D intake. Practical recommendations for coffee drinkers. Given the potential effects of coffee on bone health, individuals should consider the following recommendations. Moderation: aim for moderate coffee consumption. Most studies suggest that 3–4 cups per day are safe for most individuals. Calcium-rich diet: ensure an adequate intake of calcium. Dairy products, leafy greens, and fortified foods can help meet daily calcium requirements. Vitamin D supplementation: consider vitamin D supplementation, especially in regions with limited sunlight exposure. This can enhance calcium absorption and support overall bone health. Physical activity: engage in regular weight-bearing exercises, which can strengthen bones and reduce the risk of osteoporosis. Monitor bone health: individuals, especially older adults or those with risk factors for osteoporosis, should regularly monitor bone health through screenings and discussions with healthcare providers. The effects of coffee on bone health are complex and multifaceted. While high caffeine intake may pose risks for bone density, particularly in individuals with low calcium intake, moderate consumption appears to be safe for most people. As research continues to evolve, it is crucial for coffee drinkers to balance their caffeine intake with a diet rich in bone-supporting nutrients, engage in regular physical activity, and monitor their bone health, especially as they age. By making informed choices, individuals can enjoy their coffee while maintaining strong, healthy bones. Thanks for watching. Please like, share, and subscribe. Click on one of the videos on your screen to learn more about how to live your best health and life.